These are the exercises that help strengthen the pelvic muscle system, which controls all of our sexual function. And what we did is we created a program that teaches men how to do this. It's like the personal trainer for your pelvic muscles. Takes you through week by week, teaches you how to strengthen these muscles, and then provides a resistance device that then places resistance to dramatically strengthen them. And what we saw with them were remarkable results.
So Kegel exercises for a lot of people, I mean, women know this because after pregnancy, they continue to do it to strengthen their muscle, as you mentioned. I have never heard of Kegel exercises to improve sex life. That's why I was so fascinated when I learned about private gym, and we've talked about this, and I'm actually giving it to some of my patients who've done quite well. How long has this been in the market? What is the feedback from the patients, and what are you hearing?
It's only 6 months old, and the feedback has been tremendous. I just finished, we have several thousand men using the product now. I just finished 100 customer interviews, and they're really remarkable. I had, we've had several men, this is ranging from 29 to 74 years old. So as a young male, it improves sexual performance by strengthening those muscles. As an older male, it helps reverse a lot of the conditions, including erectile dysfunction. But what really is remarkable is your prior guest mentioned about aging and exercise. This is the one true way you can really improve your body through exercise.
Okay, so I'm holding this. This is what people are going to get in mail, right? They're not going to get a room full of these like weights. This is private gym. This is what they're going to send you, and we can talk about the price later on. But how does it work? I mean, do you have maybe you can demonstrate
absolutely
exactly how this works? And it comes with all the instructions, and people are going to know how to follow this. It's easy.
Again, it's simple, and it's like the personal trainer for your pelvic muscles. It comes with a DVD and online access. Takes you through week by week. You follow along with the exercises, and then this is a Class 1 medical device. It is a super soft silicone ring that weighs 2.5 ounces. This goes on the erect penis, genitalia, right. And it's lifted up and down, then producing the resistance against the muscles.
That's fascinating.
Women have this, but the devices are invasive. This is a non-invasive way of strengthening some of your most important muscles, which we never think about exercising.
So I'm not going to ask you exactly why you came up with this idea and what in the world was going through your mind when you came up with this whole weightlifting thing on the genitalia, but clearly it works. I have a better treatment for sexual function. It may be a little competitive to you, and because we have our Italian host over there, I'm going to play some Italian music that can actually improve anybody's sex life out there. And women and ladies, come and tell me on my blog whether this medication this music is working for your sex life or not. Here we go. This is for the Italians out there.
Sono innamorato di Marina, una ragazza mora ma carina, ma lei non vuol saperne del mio amore. Cosa farò per conquistarle il cuore? Un giorno l'ho incontrata sola, il cuore mi batteva a 1000 all'ora. Quando le dissi che la volevo amare, mi diede un bacio e l'amo sbocciò. Marina, 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 ti voglio al più presto sposare. Marina, 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 ti voglio al più presto sposare. Oh mia bella mora, non mi lasciare, non mi devi rovinare.
All right, because we have so many guests, sometimes, I worry that we're not answering some of the calls, and I apologize. Why don't we go to Barbara and get one phone call, and then when we come back, we talk to David more. Barbara, are you online still?
Yes, I am. Good morning, Dr. Samadi.
Good morning. How are you?
I'm very, very good.
Tell me you were dancing with me all day today.
I definitely was dancing, especially to your Italian tune, saying that I am Italian.
Okay, I'm glad, Barbara. Tell me what you have in mind.
Well, Doctor, I just wanted to briefly talk to your female audience on the importance that they play in the role of their husband's medical screenings. Our personal experience, my husband was very, he did not want to go to doctors. Physicals were out. He had a very healthy lifestyle, very active, no family history of any illnesses at all, not heart, not cancer, nothing. However, on the other hand, I was always trying to push him into going to physicals. And finally, one day he took my advice, and I took matters into my own hands and made an appointment. and much to our surprise and dismay, he had a very high PSA level. Biopsy confirmed he had prostate cancer.
I see. And how is he doing now?
Oh, he's doing terrific after your very, very successful surgery.
Oh, you're a patient of mine. Okay,
yes,
good.
yes, we are patients of yours. And first
That's
saw
very
you
nice.
on Fox Sunday News and followed
Wonderful.
you very often. And, you know, we've listened, doctor, to many theories and studies and opinions that, you know, that were very popular, like you'll die of something else before you die of prostate cancer. And quite frankly, I wasn't a big fan of that theory. And, you know, decided to call your office and make an appointment with you. And my husband was very resistant to surgery. He didn't want to think about it. You know, I forced him into coming to the visit, and we knew immediately upon meeting you.
Thank
and
you.
my husband, at that moment of meeting you, decided that he not only wanted the surgery, but you were the surgeon for the job.
Well, I really appreciate it. I think you guys are truly wonderful. You know, a lot of these callers that comes in, I have no idea which state, where they come from, but I love what I do, obviously, because it's coming back to us a million times more. And first of all, I love you. I love your husband. I'm glad he's doing well from prostate cancer. This watchful waiting business is very tricky business. A lot of urologists are overdoing it because it's always easier to tell the patient, oh, we're going to watch it. And on the other side, you have the surgery that you're worried about, incontinence and sexual dysfunction. But given the experienced per surgeon behind these robots, we see husbands of yours having good sexual function, having good continence, and they move on cancer-free. And you can celebrate the rest of many of these birthdays that come in knowing that his PSA is 0. And this is actually interesting. You brought another good point, which is the role of women. And we talked about like women for prostate health. And I want you to stay online because we're talking about like great stuff. When I do the surgery using that smart technique, we see about 80% of the patients are having a great sex life. And whether it happens in the first 3 months or up to a year, but as time goes on, they can improve. And I give a lot of these medications such as Viagra, Levitra, Cialis. But Barbara, we're talking about this private gym. And I guarantee you, it's the women that actually go out there and get this for their husband because they say, okay, so medication is fine. We're going to take it, but can this also be another addition to some of the things that we do? David, do you see that the women are getting involved in this?
Absolutely. We have 25% of our sales are women buying the product for men because they are, you know, in many cases, the caregiver for the men in the household. And especially for this with prostate surgery, if you're going into prostate surgery, strengthening the pelvic floor, as you know, beforehand
That's
is critical, is absolutely critical. This is the exercise program before prostate surgery.
Where is this study and data as far as this is concerned? Where are we? What phase exactly? What's been published on this?
There is tremendous, there are a number of studies out there that go to the importance of strengthening the pelvic floor before prostate surgery. We actually engaged in a 4-month clinical trial with the private gym that showed remarkable results, 75% improvement in erectile function. One of the interesting things was 90% improvement in self-confidence in the bedroom too.
That's very interesting.
Because you're focusing on a part of the body.
Well, that's a good point that you're bringing in, because I think when it comes to sex life, it's not always physical. I think the psychological part of it plays a huge role, and especially when people are after surgery, they may not be as confident and they may be like a little intimidated by this. So this may be bringing their mojo back and make them stronger.
Training for the bedroom. I mean, for men, this is what we should do, and women, they should celebrate this.
Oh, instead of going to church, we're gonna like use like private gym. My goodness, I hope like nobody is watching up there. What's the site? Where do they go to get and look at this?
Privategym.com. It's also sold on Amazon.
And what's the price?
Price point is $99 for the product, so it's very reasonable.
This is $99?
That's it. Yes.
Oh my goodness, it's priced very well. I really thought it's going to be in hundreds of dollars, so that's an easy investment. It's cheap, and I think it's great. You know, Barbara, are you still on the phone?
Yes, I am, doctor. And I just wanted to comment briefly, a personal note to you, how incredibly gifted of a surgeon you are, and you epitomize everything really a doctor should be. You're kind, caring, and compassionate. You treat the whole person, not just the disease. Everyone's opinion is valued. Your Madison office staff, as well as your staff at Lenox Hill Hospital, are quite frankly an extension of who you are And my family and I thank God every day that He has blessed you with the incredible gift of healing.
Oh my goodness, that was
There
like
is only one Dr.
Barbara.
Samadi.
Did Dr. Samadi pay you to say all of these great
No,
things? I love it.
Absolutely not. I cannot stress to the callers out there the experience that my husband and I have had, including my entire family. We are eternally grateful. You are an unbelievably kind and caring man, and I just wanted to stress that the importance of having a wonderful, wonderful surgeon, which you most definitely are.
Okay, I appreciate that, and I'm also really flattered by you saying all these great things. This was not set up. I guarantee everyone out there, when you do the right thing for your patients, I walk into Madison Avenue or Park Avenue, within 5 blocks, I see one of the family members from years ago that I've operated on. It's a blessing, and I'm very fortunate to be in the middle of this. Barbara, because of all these great things, I want to play you something really nice, this music, and when we come back, we'll finish up with David. I hope you stand up and dance with me. It's a great Sunday morning. We got our vitamin dose. We got our anti-aging. We improved our sex life. The only thing that's missing is Barbara and Dr. Samadi dancing together. Stand up and let's go for it.
Bueno, ok, síguelo, eso me gusta, síguelo y súbelo y gózalo y disfruta, ya. ¡Guapa! Sigue, 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 sigue. Guapa, tú sabes lo que doy ya, mamá, está enamorada, ya está, la olla calentita, hoy aquí y no sé mañana.
All right, that was dedicated to Barbara, and you can see that in the floor that we built at Lenox Hill Hospital is amazing. I did it because everything I've set up for any patients that come in with prostate cancer is the way I would want to be taken care of. I'm seeing them in our Madison Avenue office because I don't want to be in the cancer center, and I don't want them to be next to all these pancreas and liver and death. Everybody's running to cancer center, and I'm running away from that when it comes to prostate cancer because there are no symptoms. And these guys are coming in absolutely good shape, and they're like, why am I over here? When they go to the hospital, I perform the entire surgery for them for prostate cancer. The result has been superb, over 6,000 of these surgeries. And then the floor that Barbara was talking about is they go there, they have their private chef, they have private rooms. The bathrooms are designed the way I have them at home. It's really giving 200% to the way care should be. There's no infection. And the nurses, and this is, saluting the nurses on 5 Wallman, who really work very hard, and also my staff in the office that work 24 hours a day to make sure that people like Barbara get the best care. I appreciate your comments. I want to go back to Dave Mandel, privategym.com, and this private gym, which is part of what we call a penile rehabilitation, as part of a surgery that we do for prostate cancer, or if you're just diagnosed and you're not happy with the way the engine is working down there, the machine is not in high gear, the wife is complaining sometimes, and as we get into our 40s and 50s, things are not running the way it should. And with $99, this is a small investment in making your bedroom happy.
Well, and more than that too. We spend so much time in the gym as men working out every other part of our body, except this part of the body where so much goes wrong as we age. I mean, just even think about incontinence. This strengthens the pelvic floor, has a dramatic change there for men with incontinence. This is a wellness product.
And I think there's no reason why they can't combine this with any other modalities. I mean, you can take, if you want to take Viagra or Levitra Cialis, so that's biological from inside out, and this is from outside in that you can take care of.
And absolutely, we have a lot of men that use Viagra and Cialis when they get to the resistance training portion of this, because it's giving them the ability to lift the super soft silicone ring, but it's strengthening the pelvic floor and hopefully working to back them off the medication. So the two work together.
Well, David, it was a pleasure to have you here. I'm so glad that you, as an innovator, has come up with this, because it's one other option for a lot of men out there. And the message to women is out there is you want to keep men healthy and happy. And I'm sorry that 1 hour just flew by so fast with all this detail and music. Have a wonderful week. And this is one more for you guys. And enjoy this Sunday. Happy Easter to all the Greeks out there.
You've been listening to World Health News with Dr. David Samadi. To contact Dr. Samadi, please call 212-365-5000. That's 212-365-5000. Join us again next week at this same time for more of World Health News with Dr. David Samadi.